Are you currently taking Warfarin, and do you have surgery coming up? If so, then this video is for you. We'll discuss what you need to know about continuing or stopping your Warfarin therapy before your procedure. Hi everyone, I'm a healthcare provider. Welcome back to our channel. Today we're going to talk about what you need to know if you are on Warfarin and have surgery coming up. We will also answer some frequently asked questions. If you're new here, please consider subscribing and turn on notifications so that you get alerted the next time we post a new video. And lastly, please give this video a like if you find it useful. So, let's jump into it. There are several things that you need to know if you are on Warfarin and have surgery coming up. Number 1, assess your thrombotic and hemorrhagic risks before surgery. This means that your doctor will evaluate your medical history and determine whether or not you are at high risk for either blood clots or bleeding. Number 2, continue or discontinue Warfarin therapy based on your individual needs. If you have a high risk for bleeding, your doctor may have you stop your Warfarin 4 to 5 days before surgery to allow your INR to return to baseline. However, if you are at high risk for clotting, your doctor may have you continue your Warfarin therapy right up until the day of surgery. Number 3, resume Warfarin 12 to 24 hours after the procedure. Once you have surgery, your doctor will determine when it is safe for you to resume Warfarin therapy. Typically, patients will resume Warfarin 12 to 24 hours after the procedure at either a reduced dose or at a dose that is different from what they were taking before surgery. Number 4, monitor INR levels regularly during the perioperative period. It is very important that your INR levels are monitored closely during the time leading up to and following your surgery. This will help to ensure that your Warfarin levels are within the therapeutic range and that you are not at risk for excessive bleeding or clots. Number 5, follow specific protocols for high-risk bleeding procedures. If you are having a procedure that is associated with a high risk of bleeding, such as neurosurgery or orthopedic surgery, your doctor may have you follow a specific protocol to prevent bleeding. This may include stopping Warfarin for a longer period of time before surgery or using a different type of anticoagulation therapy during the perioperative period. Lastly, number 6, postoperative care. Anticoagulant therapy can increase the risk of complications following surgery, such as bleeding and hematomas. Therefore, it is important that your doctor and your care team are aware of all of the medications that you are taking, including any over-the-counter or herbal supplements that you may be taking. As we mentioned earlier, it is crucial that patients who are on Warfarin and have surgery coming up get their INR levels checked regularly before surgery. This will help to ensure that the INR levels are within the therapeutic range and that there is no excessive risk for bleeding or clotting. Any surgery can be challenging, but certain types of surgeries are more invasive than others. If you are on Warfarin therapy, your doctor may have you stop the medication for a certain amount of time before the surgery. This is because some types of surgeries, such as brain surgery, spinal surgery, or joint replacement surgery, carry a higher risk of bleeding. If you have a surgery that carries a high risk of bleeding, and you are on Warfarin therapy, your doctor may have you stop the medication for up to 5 days before the surgery. During this time, if you are at high risk for clotting, your doctor will likely have you on a different type of anticoagulation therapy, such as low molecular weight heparin, which can be Lovenox, or another injectable anticoagulant called Arextra. Your doctor will determine which bridging agent is right for you. Lastly, the type of surgery that you are having will also help determine the risk of bleeding. For example, a total knee replacement or a total hip replacement carries a higher risk of bleeding than a cataract surgery or tooth extraction. We hope that this video has been helpful to you and that it has answered some of your questions about Warfarin and surgery. This channel is not for medical advice. Please remember to consult with your doctor if you have any concerns or questions about your anticoagulation therapy and upcoming surgery. Stay healthy and take care. Please don't forget to like, share, and subscribe to our channel for more educational videos.